Hello, my name is Marlon Charles. I am a family nurse practitioner student at Harding University. Today we're going to be doing a HEENT or head, eyes, ears, nose, throat exam along with the throat and integumentary system, which consists of the hair, skin, and nails. I'm going to wash my hands over here. Have the patient tell me her first and last name.
Lisa Charles.
Lisa Charles it is. Miss Charles. Okay, so we're going to do inspection first. We're going to take a look at the patient's head. It is centered and proportionate. We're going to use the tongue blade to assess the hair and the scalp here. This is still part of the inspection. Good hair hygiene. The hair is dark brown. There's no lesions or nodules on the head. You want to make sure to look behind both ears as well. Okay, then it's kind of palpation. You want to feel for any lesions? Any spots of tenderness? Anywhere tender at all? Then?
No.
Good deal. Okay. That completes the head. Now we're going to go to the eyes. So we can see that we want to do central vision first. We use this chart here. Have the patient cover one eye and read the smallest line you can to me, please.
LTFPH.
Okay, that tests central vision, and we repeat that for the other side. Okay, now we want to check peripheral vision. So we have patient cover one eye. We're going to be checking 4 quadrants. I'm going to cover my eye as well, because if I can't see it, neither can the patient. And make sure you look straight at my eye, please. How many fingers am I holding up?
2.
How many fingers?
3.
How many fingers?
5.
How many fingers?
2.
All right, we repeat that for the other side as well. All right, we want to take a quick look here. We're going to take a look at the sclera, the conjunctiva, pink. The conjunctiva is pink and moist, intact. Sclera looks good as well. All right, we're going to check the cornea. Have the patient look straight, please. I'm going to come at it from the side. The cornea is clear and continuous. That looks good. Okay. We're also going to check extraocular movements. Have the patient focus on your finger here. We're going to be doing an H pattern here in 6 directions. Follow my finger, please, without moving your head, just your eyes. Good. Good. All right. And have the patient focus on your finger, please. All right. 2 things should be happening here. The eyes should be converging and the pupil should be constricting. That demonstrates cranial nerve 3. The oculomotor nerve is intact. All right. So we're going to check the patient's pupil reflexes. Look straight ahead for me. All right. There's constriction there. We do it again, same eye, that should be constricted as well. Good to go. Okay, next we're going to do the fundoscopy examination. For this, you need to dim the lights in the room. Have the patient look straight ahead for me, please. Look straight ahead. We're going to be first looking for the red eye reflex. Red reflex, as soon as we see that, we're going to go straight in. Here we're going to see the blood vessels in the eye. We're going to see the optic nerve. You see the optic nerve is pink, yellowish pink, and the retina is dark orange. The borders look good on the optic disc, and you want to, of course, check the other side as well. Now we're going to palpate the eyes here. We palpate the lacrimal gland, the eyelids, the eye globe. Any pain or discomfort, tenderness?
No.
No nodules noted. Periorbital area, no pain or discomfort. Okay, that completes the eyes. Next thing we're going to do is check the ears. We want to check both ears. We want to take a look at the upper portion or the auricle first. There's no discharge, no lesions, no edema. The lobe is intact. Okay, the tragus looks good. We're going to take a look inside the patient's ear. Okay, for adults, you up and out. Okay, you want to visualize the tympanic membrane, which should be pearly or pinkish gray. Pearly or pinkish gray, there's no tumors. The cone of light reflex is visible. The incus and the umbo are visible. Now we're going to palpate the ears here. Any pain or discomfort?
No.
Want to pinch the tragus? Any pain or discomfort?
No.
Okay, next we're going to quickly do the whisper test. Have patient cover one ear. Whisper a word.
Blue.
Okay, good. And the other side, you repeat on the other side as well. Alright, we're going to do the Ryan and the Weber test. We're going to do the Weber test here first. Put it on the patient's forehead. Do you hear that in both ears?
Yes.
Is it the same in both ears?
Yes.
Alright, that's Weber test here. We're going to do the volume test here as well. Do you hear that?
Yes.
Okay, you just put on the patient's mastoid bone here. Do you still, tell me when you don't hear it, no longer hear it.
Now.
And you hear this.
Yes.
Good. Alrighty. So that's the Weber and Wright test. The last thing we want to do here is the Romberg test. Have the patient stand up. Okay. You can stay this way. And put your feet together for me. And put your arms straight out. Arm straight out, arm straight out. Okay, good. Patients, look straight ahead. Keep eyes open. Okay, good. Go ahead and close your eyes for me. Okay. And that's good. Go ahead and have a seat for me. A positive Romberg test, the patient would sway, lose balance, want to fall over. Okay. Doing good on time so far. So that completes the ears. Now we're going to check the nose. Nose. No redness, no edema, no visible lesions on the outside of the nose. Have the patient, the nostrils are symmetrical. Have the patient, please, do this. You can breathe.
Yes.
Well, other side. All right, perfect. No drainage, no discharge. We're going to quickly check the olfactory nerve. Go ahead and close your eyes for me. And occlude one nostril. Tell me what you smell there.
Peppermint.
Okay, other side. Close your eyes. Thank you. Smell. What do you smell there?
Mouthwash.
Perfect. Patient got both of those right. That checks cranial nerve number 1 of the olfactory nerve. All right. Now we're going to take a look at the patient nose. Tilt your head back for me. Just going to push it up here a little. Okay. There's no drainage or discharge. No blood. The turbines are dark red and moist. That is good. That's good there. Nose. Okay. Now we're just going to palpate the nose a little bit here. No pain or discomfort. Okay. Now we're going to palpate the frontal lymph nodes, frontal, and the maxillary, right here. Any pain or discomfort? And we're gonna just palpate or percuss. Any pain or discomfort?
No.
Okay, do that on both sides. Good. That concludes the nose. Now we're gonna take a look at the mouth here. We want to inspect, see the mammillary borders intact. There's no drainage or any open wounds on the lips. Okay. All right, let's take a look here. All right, let's take a look. We're looking, the gingiva is clean, intact. All the teeth are evenly spaced. All right, the hard palate is soft palate. All right. See the stents ducts on the cheeks. All right, lift up your tongue for me. Good. See the Morton's ducts at the bottom, on either side of the frenulum here. All right. Now, go ahead and say ah. All right, that shows cranial nerve number 9, or glossolaryngeal is intact. And we're gonna just gag a little here. Sorry. That's cranial nerve 10, as the vagus nerve is intact. All right, we're going to. We're good. Alrighty. So far, so good. Okay. Now we're going to palpate the patient's mouth here. Sorry. Alright. Oh, yeah, on camera. See here? You want to use a light. You want the cheeks. You want the hard palate, the soft palate, the teeth. There's no loose teeth there. Good. And you want to. Let me see your tongue here. You want to grab the tongue with this. And you want to palpate the tongue to see if we feel any nodules. There's no nodules, no edema noted. That completes the oral exam. That completes the third exam. Okay, now for the neck, we're going to inspect the neck here. And you want to see the color is color stays. There's no color variation. Okay, there's no visible masses, no jugular vein distension noted at all. Okay, so now we want to palpate here. We're going to palpate the thyroid. There's no tender. Is it tender? No, it's not enlarged. Okay. We'll also go ahead and palpate the carotids while we're here. Good. Check the thyroid for bruise. Listen. Okay. All right. Good. Little bruise noted. Check. Okay. Okay. Good deal. Now we're going to go ahead and check the lymph nodes here. We check the back of the neck here. Has it cold? Yeah. The preauricular front of the auricles. auricular, the tonsillar lymph nodes, submandibular lymph nodes here, subclavicular on top of here, and underneath the clavicle. Good deal. Good. And that completes the neck exam. Now we're gonna do the skin exam here. Okay, we already did the head. We checked the hair is evenly distributed. There's no balding or alopecia noted in the hair. The hair is part of that exam too. So we're going to take a look at the skin here. We're going to take a look and we're feeling as we look, okay? I do see one lesion here. We're going to go back to that lesion. Of course, you want to look in the front. Good, I'm sorry, good. We'll look at every inch of the patient. For the sake of time, we're just going to do one side here, but obviously we do two sides. I'm going to check skin turgor right here. The skin should bounce back. That's good. Good. Of course, with women, you want to look underneath the breast, have them raise the breast, and you look and feel underneath there. Okay. You want to definitely check between the fingers as well. Okay. You want to make this a good detailed examination. Want to go and check the nails. They're adhered to the nail bed. There's no signs of infection. We're going to check capillary refill. It should be less than 3 seconds. Okay, you want to check the patient's legs. You're going to check all this in the front. Okay. We're going to pretend the socks are off, but you check the feet. You look at the toes. Check cap refill down there. Make sure to look underneath the feet, between the toes. Okay. And then we'll repeat that for the back. Go ahead and stand up for 1 second for me, please. And turn around. I'm just going to do this quickly for the camera. While we're checking the back, we're also checking the spinal cord. Make sure it is aligned. Sorry. And good. You want to check the back of the legs here as well. You can go ahead and have a seat for me. Okay. So lesions, we had this one lesion right here on the patient's chest. This is a primary lesion. You want to use the A, B, C, D. E is for detecting melanoma. A is the symmetry. So we see this is symmetrical. It's circular. B is bordered. The border is intact. There's no ridges. The C is the color. This is a flesh color nodule, and it's palpable. I can feel it. Okay, so all right. So we need to know the size. Have a measuring thing here. So we take a look at it, and it is about half or a little less than half a centimeter. So this skin lesion is a papule. Okay. So to about finish here. To wrap this up, you want to tell the patient that everything looks okay. Everything looks pretty good. I didn't notice any abnormal findings at all. At this point, you would also want to educate the patient on how to perform a breast self-examination, say at home in the shower. For the best time to do that for women who are still menstruating is 3 to 5 days after the period begins. For women that are in menopause, you want to do it at the same day every month. That is, again, a monthly exam. We also want to educate the patient on the ABCDEs. So you want to, keep looking at this, okay? If it just changes the color or the borders just get irregular, it just changes drastically, you can follow up with me. Or if you had noticed a lump in your breast during your breast exam, you can follow up with me as well. Any questions or concerns, ma'am?
No.
Alrighty. And that concludes our exam. Have a good day.